Good evening. My name is Mary Lyons, and this is my presentation on the mental disorder OCD. I chose OCD because I've had OCD for most of my life, and I thought this would be a great way for me to learn more about it. So, what is OCD? OCD is obsessive compulsive disorder. It is a mental illness that causes repeated thoughts and sensations, as well as urges to want to do something over and over again. So when it comes to the thoughts and sensations, that is considered to be obsessions, where the urge to want to do something over and over again is actually considered to be compulsions. A person typically shows either one of obsession or compulsion, but it is common to see an individual having obsessions and compulsions. So when looking closer into obsessions, there are a few things that um, typically you will see. The fear of contamination. So if an individual has the fear of something being overly dirty and feels like the need that it can't be needs to be cleaned and it's just overly dirty. The fear of causing harm. This revolves around causing harm to yourself or causing harm to another individual. Superstitious obsessions. This could be something like counting to the number 4 in your head for everything, or something, the typical superstitions like throwing salt over your shoulder for good luck. There is sexual, violent, intrusive thoughts. There is pathological doubt. And then there is the need for symmetry and exactness. And this is basically where something is out of place and needs to be put into a position of your liking. Now, compulsions. Compulsions, these are repetitive checking. So, for instance, someone constantly checking to see the lights are off, checking if a door is locked, if the stove is on. There's ordering, arranging things. This is the physical act of moving something into a position of your liking. Cleaning and washing rituals, that is also the physical act of when the feeling of something being dirty, it being washed and clean until it is fitting to that person's liking. And then there is superstitious rituals. This is, again, the physical act of doing something because of superstitious thoughts. So when going back to obsessions and looking at both of them, obsession seems to be more of the mental thoughts of the disorder, and compulsions are actually the physical acts done for the urges, uh, and that is performed for the OCD. So when looking at obsessions and compulsions, typically a person will fall between 1 to 4 general categories that was listed, and the 4 main ones that people tend to show are checking, which again is the act of checking lights, checking the gas, checking that the door is locked. Contamination, if something seems dirty, it just doesn't feels gross. Symmetry and ordering, something needs to be moved into a position of your liking. And then rumination and intrusive thoughts. Now, these thoughts are overpowering flood of thoughts in your head, and they can even get pretty dark. And for me personally, this is where I've shown most of my OCD. I've shown it a lot with my schoolwork, that I've got to overpowering thoughts in my head that regard my schoolwork. And then when I was younger, it was more leaned towards my friends and overpowering thoughts that way. Cause and risk. So the cause for OCD is actually unknown, but it has been shown that stress does enhance your symptoms. It also has been shown that it is more common in women rather than men. And it often first appears when you are a teen or when you're in your young adult life stage. Risks that should be considered when having OCD is that it can lead to depression, anxiety, even some tics that could form. OCD has shown to be in correlation to an experience of trauma, as well as a physical or sexual abuse. Diagnosis and treatment. The diagnosis for OCD, there's only really one form to actually be diagnosed, and that is to talk to your doctor about any feelings you're having, thoughts, or habits that you have been showing recently. Unfortunately, there is no cure for OCD, but there are actually plenty of ways that you're able to manage your OCD. For instance, psychotherapy. It actually has been shown that psychotherapy uh, allows you to train your thinking patterns so that the severity of your OCD symptoms can actually be minimized, and it definitely is shown to help a lot with many people. Relaxation, as simple as doing yoga, getting a massage, meditating, something to reduce the stress. And because, again, the stress actually makes the symptoms enhance. So there are actually also medication you can even take for OCD. And those medications are escitalopram and sertraline. And finally, there is TMS. TMS is transcranial magnetic stimulation. Now, what that is that it's where TMS units are held above your head, and it introduces a magnetic field, and it targets specific parts of the brain, and that regulates the OCD symptoms. Now, when having OCD, there are also other related conditions that you should be mindful of that can appear because of the OCD. There is body dysmorphic disorder. This is where you view your body in a certain way. You can view it negatively. You're very judgmental towards your body. Hoarding disorder. This is where you obtain and essentially organize items. Trichotillomania, that is where you physically are pulling your hair out and you may even eat it. Excorrelation, that is the picking of your skin. Hypochondriasis, that is the when a person is actually physically ill. So it's like you made yourself physically ill. And then there is olfactory reference syndrome. This is where this is associated with smelling and your body odor. So with having OCD, these are a bunch of symptoms that you want to watch out for because they can occur. And so that is the end of my presentation on OCD. I learned a lot from research on this, and I hope that my research has made, made it more aware to everyone. So thank you.